You are watching Radicon. Let's look at these two cases simultaneously. Both are T1 weighted sagittal acquisitions from two different patients demonstrating end plate degenerative changes. You can see that there is reduced T1 signal around the end plate in both patients. Which one of those represents end plate degeneration and which one is discitis? We can have a look at their sagittal T2 weighted images. Both demonstrate high disc T2 weighted signal. We know that to call it discitis, we ideally want to see higher T2 signal in the disc equal to the CSF space, which is seen on both these cases. These particular patients, for example, could have renal failure and IV contrast is not possible. So how we can possibly differentiate between end plate degeneration and discitis without giving IV contrast? Let's look at them together. Is there any clue on those images which can give you a hint of etiology of the end plate degeneration or discitis? For these sequences, there has been a paper which described diffusion weighted image sequence application to differentiate between these two. On the left side image, you can see a fine line of edema differentiating between the abnormal signal or the normal signal of the marrow in the vertebral bodies. While on the right side, you can see diffusely abnormal signal affecting both vertebral bodies. Based on the conclusion of the paper, it is said that if there is a fine line differentiating between the normal and abnormal marrow signal, it is thought to be degenerative type, while more a diffuse involvement of the vertebral body suggests infective pattern. In the hindsight, if you look at the T1 weighted images again, you can see a fine line of differentiation between normal and abnormal marrow signal, which is very diffuse or indistinct on the right-sided images, hence suggests discitis. That concludes our discussion on D or discs. We discussed alignment, A, body height, B, conus or chord, C, and discs, D. Next is extra features or E.
You can subscribe to our YouTube channel and click on the notification bell for new courses. For more modules and Radiology CMEs, please visit www.radicon.org.